Hello, my name's Lucy Adams. I'm one of the consultant anaesthetists working for the Northumbria Healthcare Trust. And I'm going to talk to you a little bit about epidurals and hopefully answer any questions that you may have. So could you have an epidural in labour if you've had a previous caesarean section? The answer to that would be yes, absolutely you can have an epidural in labour. We would always advise that you consider working your way up as what we call an analgesic ladder. So you'd start with more simple pain relief methods, such as the paracetamol, dihydrocodeine, and then as labour gets more strong, then we'd be looking at methods such as gas and air and intramuscular opioids. But absolutely, if you get to a point where the pain is getting too severe, then you would absolutely be able to have a labour epidural. In fact, one of the benefits of having an epidural is the fact that we could utilise this if you did need further operative delivery, and it would expedite that delivery. One thing that might be worth knowing about epidurals is that we actually term them low dose or mobile epidurals. And what this means is we're using very weak solutions of local anaesthetic, which are infused into your back to keep you comfortable. And the idea behind this is we would like to achieve a situation where we make you a lot more comfortable, but it doesn't cause excessive numbness or weakness of your legs, and this enables you to still be aware of your contractions, still feel pressure, and still be able to push when you need to. Obviously, having kind of a low dose epidural also would mean that any signs or of any uterine pathology would not be masked by an epidural, which is very reassuring. If you had an epidural previously for your delivery and it wasn't effective, I can understand you might have concerns that this situation might happen again. I'd like to reassure you that that's not definitely going to be the case. Epidurals can be a little technically challenging to place. We're putting a very, very fine catheter into a small space in your back, and about 1 in 8 are prone to not working optimally and not giving you the pain relief that you're hoping for. Now, we can come and fiddle with your epidural, and there are techniques that we can use to try and optimize it. Unfortunately, sometimes we would even recommend resiting your epidural. But I would like to reassure you that just because it happened before does not mean that that will be guaranteed to happen again, and you may on this occasion have a perfectly good working epidural. Occasionally, due to the busyness of delivery suite, an anaesthetist might not be able to get to you straight away to do your labour epidural. In this situation, we would recommend considering having intramuscular opioids such as diamorphine or pethidine, and this won't stop you having an epidural when the anaesthetist becomes free. So if you are being induced, a lot of women are very keen to consider an epidural, as we do know that the induction process sometimes can be more painful than a spontaneous labour. However, we would want to see that labour is becoming established and your contractions are becoming regular before we place an epidural for you. And this is where more simple forms of pain relief may come in useful. So in the early stages of labour, very much we would encourage active mobilisation, and once an epidural is in place, then we need to increase our level of monitoring, and you would be a little bit more confined to the bed. And this does have implications for looking after your skin and keeping you mobile as long as possible is really beneficial for you. There are some women who have medical conditions or have had previous experiences that it may be useful for you to see an anaesthetist or to talk with an anaesthetist before your delivery. In this circumstance, your midwife or a member of the maternity team will refer you to the anaesthetist. The anaesthetist will then either send you a letter in the post so you have an appointment in clinic to go and see them, or you will receive a phone call to discuss the anaesthesia for your delivery. And this would include techniques for providing pain relief, but also if you did need an operative delivery, how we could safely achieve this for you. If you do need an emergency caesarean section for the delivery of your baby, then an anaesthetist will come and see you and find out more about your history and understand how quickly the baby needs to be delivered, and then we'll talk to you about the best way they feel they should anaesthetise you for that procedure. There are two main methods of anaesthesia, and one of those is regional anaesthetic, where you will remain awake. You'll have an injection in your back to numb you, but you would be awake throughout the procedure. And the other choice is a general anaesthetic, where obviously you go off to sleep for that procedure. Now we know, because of the changes that your body undergoes during pregnancy and labour, that staying awake for the birth of your baby is safer for you and your baby, and we would strongly recommend that option over a general anaesthetic, unless there are specific situations where we'd look at a general anaesthetic instead. A regional anaesthetic can either be an epidural that is topped up from a labour epidural to convert it into an anaesthetic, or it can be a spinal anaesthetic. Both these involve the injections in your back, and they do come with some risks of a reduction in blood pressure or causing a headache, which may need further treatment. And there are also very much less frequently occurring and rare risks, such as introducing infection or causing damage to nerves, but these are extremely rare. Occasionally, as I mentioned, we do need to give general anaesthesia as baby needs to be born quickly, or unfortunately some women are unable to have a spinal anaesthetic due to medical conditions. And in this situation, we would take precautions to make it as safe as possible for you. One of the major benefits of having a regional anaesthetic is obviously to be awake for the birth of your baby and to have your partner with you, and that gives a lot of psychological benefits too. You will have a choice, however. It's important to say that although we would strongly recommend that you would remain awake, we would encourage you to consider that. Ultimately, it's your decision, and if there are specific concerns you have, then we would ask you to discuss those with us, and we will always respect your decision. So that's everything from my side at the moment, but just remember that there's always an anaesthetist on the birthing centre at Cramlington 24/7. So when you come in, if you need additional pain relief, we will look forward to seeing you then. Thank you.